Welcome to today's webinar, where we'll be discussing Comparative Billing Reports, or CBRs, and more specifically, CBR 202107, Wound Debridement. My name is Annie Barnaby, and I work for Rely Group, Inc., who is contracted with the Centers for Medicare and Medicaid Services, CMS, to develop, produce, and distribute CBR reports. We've developed various resources to accompany this webinar, and those resources are listed here for your convenience. We do have the webinar slides available to you, this recording of the webinar, and of course, the Q&A and CBR Help Desk are great tools to use if you have any questions. We're here to help, so don't be shy about reaching out to us. The objectives of today's webinar will be to understand the purpose and use of Comparative Billing Reports, CBRs, to explain the function of this specific Comparative Billing Report 202107 Wound Debridement, and to help you gather resources that will help answer further questions and inquiries. To accomplish those objectives, our discussion today will cover the following areas. First, we'll talk about what a Comparative Billing Report, CBR, is. I will show you how to access your CBR. I do have a sample CBR that we will review so that we can get a good sense of what we're looking at when we review a CBR. Then we will go into a discussion of this CBR and go through the details of the topic and metrics for CBR 202107. And finally, I will show you some helpful resources should you have any questions following the webinar. So let's get started. Let's start at the very beginning. What is a CBR? Well, CBR stands for Comparative Billing Report. And according to the CMS definition, a CBR is a free comparative data report that can be used as an educational resource and a tool that providers can use for possible improvement. A CBR is truly what the title says, a report that compares providers on a state or specialty and nationwide level and summarizes one provider's Medicare claims data statistics for areas that may be at risk for improper Medicare payment, primarily in terms of whether the claim was correctly coded and billed and whether the treatment provided to the patient was necessary and in line with Medicare payment policy. A CBR cannot identify improper payments, but it can alert providers if their billing statistics look unusual as compared to their peers. Taking a look at the history of the CBR, we can see that this program was spearheaded in 2010. In 2018, CMS combined the CBR program with the PEPR program, which is the Program for Evaluating Payment Pattern Electronic Reports, to put both programs under one contract. And then beginning in 2019, Rely Group has partnered with TMF and CGS to create and distribute CBRs and PEPRs. Now that we have a sense of history of the CBR, we can discuss why CMS issues CBRs. Well, CMS is mandated and required by law to protect the trust fund from any improper payments or anything else that may compromise the trust fund. CMS employs a number of strategies to meet this goal, which include education of providers, early detection through medical review, and data analysis. And CMS considers the CBR process to be an educational tool that supports their efforts to protect the trust fund. CBRs serve several purposes on the provider side as well. The CBR program helps to support the integrity of claim submission, and early detection of any outliers in your billing processes can help to guide a compliance program that will help to support compliant operations in your own organization. And taking a closer look at specific coding guidelines and billing procedures can increase education and improve future billing practices. As we mentioned earlier, CMS is required to protect the trust fund. To that end, the CBR 202107 was created and distributed. This CBR offers an analysis of providers' billing patterns for use by providers in their compliance processes. The topic selection is completed through research and collaboration with CMS, with the goal of drawing attention to areas of coding and billing that pose a threat to the trust fund. The metrics for every CBR are created according to the CBR topic and the potential risk to the trust fund. And the CBRs are distributed to providers based on individual provider results for specified metrics within the CBR. This CBR is an educational tool that can be used for internal provider compliance. CBRs can draw providers' attention to their individual utilization of wound debridement services and how that utilization plays into the protection of the trust fund. The supporting resources for each CBR release provide reminders of proper code selection and can be valuable additions to your internal annual compliance review. We now know a bit about the purpose of the CBR, but let's look at what a CBR isn't. A CBR is not in any way an indication of or a precursor to an audit. It is also not an indication of wrongdoing. Again, the CBR is educational in nature and should be reviewed as such. Some Medicare Administrative Contractors, or MACs, release medical review CBRs. This CBR is not a medical review CBR. Internal medical records are not reviewed. Instead, the report provides education and a summary of your claim submissions as compared to your peers. Receipt of a CBR is not in any way a prompt to make changes to your clinical care. We sometimes have providers contact us and say, does this mean I have to stop providing these services? The answer to that question is, of course, no. The report is a comparison tool. We do not in any way want to tell you how to provide services to your patients. And finally, you do not need to respond to a CBR. They are meant for internal use. We do encourage everyone to download your report so that the data is saved to your internal online files for use during those annual compliance reviews. The purpose of this CBR is, of course, directly related to the reasoning behind the distribution of CBRs. A CBR is presented to a provider when the analysis of their billing patterns differs from the provider's peers on a state, specialty, and/or a nationwide level. Again, the report is not an indication of wrongdoing, and the hope is that providers will use the data analysis to support their internal compliance. Also, providers can confirm that their billing practices are compliant with the guidelines for these difficult code sets and those services that may pose a risk to the trust fund to ensure that their piece of the billing process is appropriate and correct. As always, and as we mentioned earlier, it is important to always remember that receiving a CBR is not in any way an indication of or precursor to an audit. Downloading and saving your CBR internally guarantees availability of the report to any department or employee tasked with reviewing the CBR. We talk to providers who have noted that the saved CBR also helps with future compliance reviews. Saving an electronic copy helps to ensure that the file doesn't get lost in the shuffle. With all that in mind, let's look at how to access your CBR through the portal. I'm going to walk through the steps of accessing your report if you received one, so we can see exactly how that's done. This page, cbrfile.cbrpepper.org, contains the portal that you'll use to access your CBR. The portal does require that you enter some information, and I'm going to enter this page on my screen to show you exactly what it looks like when a CBR is accessed in this way. First, we'll indicate the role that we play within the healthcare organization for the physician or physicians who received a CBR. I'm going to indicate that I am the CEO of the organization, and by doing so, I am indicating that I have the authority to receive the CBR information and that I understand that I am authorized to view this confidential information. Next, I'll complete these two forms to indicate my information and the provider information. To access this test CBR, I, of course, have used test data to complete these forms, but you'll use the correct information here to complete them. Following these forms, we're going to indicate how we heard about the CBR that is available for the physician or physicians. This section of the access form is most telling for us and helps us to know which form of alert is working best to reach the most physicians for their CBR alert. First on the list indicates that you received an email, a fax, or a letter. These would be communications that came to the contact information that is listed in the provider enrollment chain and ownership system that's commonly known as PACOS. We do encourage everyone to confirm their PACOS information and update if necessary so that we can contact the appropriate person regarding CBR information. Confirming this information several times a year allows for that contact information to stay up to date and lessens any issues that may arise otherwise. Next on this list is indication that you saw a tweet that we sent out about the CBR program. We do tweet about the CBR releases and about these webinars. So if you saw the tweet and that led you to check out the CBR program, we'd love to know that. The next two entries, Provider or Professional Association or MAC notice, are indications of our work alongside the groups and the MACs that are so supportive of provider billing and information distribution. We are very appreciative whenever MACs are involved in spreading the word about the CBR program. And similarly, when a professional association recognizes the importance of the CBR program and the information that we distribute. We do have one alternative option, Other, and if that option applies, of course, please indicate as such. At the bottom of the form, we ask for the provider's NPI number. This will be the NPI for the specific provider who received the CBR. And I, of course, am using a standard test code for the NPI number. Then at the bottom of the form, we finally have the validation code. When a provider receives an alert that they have a CBR on file, a validation code is included with that alert information. So again, check the information on the emailed alert, the faxed alert, the letter to confirm your validation code. If you are sure that an individual provider was issued a CBR, but you are unsure of the validation code, please submit a ticket to our help desk and we can assist with resolving that issue. So I'm going to complete the form and hit submit. And here we have the sample CBR file that appears. And your CBR will appear in the same fashion in PDF format ready for your review. Let's dig into the specific topic of this CBR, wound debridement. The guidelines for wound debridement are listed in the current procedural terminology, CPT book, are listed here. Wound debridement services are reported according to depth of tissue and surface area of the wound that is treated. And here we have the list of the wound debridement codes that were included in this analysis and the description for each of the codes. This chart spells out the code description for each of the codes used in the CBR, and as you can see, they are assigned according to measurements in increments of 20 square centimeters. So we've seen how to access the CBR report. Let's take a closer look at the sample document so we can fully understand this CBR, its outcomes, metrics, and comparisons. The results shown on this CBR will, of course, differ from those on your CBR if you received one, but the formatting and sections on your CBR will be consistent with the layout of this sample document. This CBR is formatted into 5 sections, which help to focus on the process and results of the CBR. Let's go now to the sample document so we can follow along and look as we talk about each section. We start, of course, with the introduction. The introduction is a brief explanation of the specific clinical area addressed in the CBR. In this case, of course, it is wound debridement services using those specific CPT codes. You can see here information from the 2020 Medicare Fee-for-Service Supplemental Improper Payment Data Report and a reference to an article discussing the high expenditures for Medicare for wound debridement. The introduction also contains the criteria for receiving a CBR and the timeline for the analysis. Moving on to the coverage and documentation overview, this section identifies the CPT codes that were analyzed in the report. Tables 1 and 2 are listed in this section. Table 1 contains descriptions of the CPT codes. You can see those here. Table 2 contains the information for this sample provider for the allowed charges, allowed units, and beneficiary count during the analysis timeframe. The metrics of the CBR lists and explains the metrics used for the CBR, the definitions for the state and national peer groups, and the possible outcomes for the CBR metric analyses. The methods and results section is a review of the results for the CBR analysis, followed by individual results comparing CBR recipient to other providers. Following that information, the calculation for each metric is described, and then the results for the provider for each metric is shown in table form. This section also provides a graph displaying the trend over time for the provider. Finally, the References and Resources section lists reports and documents used for the creation of the CBR and those created to help you as you have questions about this CBR. During the creation of the CBR, we took into account many factors, including the public health emergency that began in 2020. We are aware of the role that the public health emergency played for all providers, their services, claims data, and therefore their claims submission. The timeline of this CBR analysis does include dates that fall within the public health emergency. We are aware of that and took that into account when we created the analysis and CBR, and we want you to be aware of that as you review your analysis and review the outcomes and comparisons in the report. Please consider how your billing practices have changed during the public health emergency when you review that data within this report. Let's take a look now at the vulnerability of correct payments for wound debridement and how that plays into CMS's protection of the trust fund. We saw in the introduction information from the 2020 Medicare Fee-for-Service Supplemental Improper Payment Data Report. That report reflects a 9.1% improper payment rate for ambulatory procedures skin, which represents $169 million in projected improper payments. Within that error rate, there is a 95.7% improper payment rate due to insufficient documentation. These statistics give us a great look into why this is an area of interest for CMS in their protection of the trust fund. What is the desired behavior for providers who provide wound debridement services? After looking at the projected improper payment rate and the cause of that being possible errors in insufficient documentation, we aim to have providers realize their role in the protection of the trust fund and offer analysis that can support internal reviews to confirm proper coding and documentation. The proper documentation for wound debridement is noted above, but of course there are expanded guidelines in the CPT book, in NCCI edits, etc. To create the appropriate distribution of CBR 202107, we analyzed rendering providers who submitted claims for wound debridement. The CBRs are distributed to providers who perform these services so that they may use the CBR as an education and comparative tool and to aid in internal compliance. The providers can use the CBR to encourage a review of these specific codes when performing an internal compliance review. To create the CBR 202107 and the metrics within the report, we used detailed information for that data during the CBR summary year of February 1st, 2020 through January 31st, 2021. The results showed that over 27,000 providers submitted these claims, which represent over $332 million in allowed charges. When we talk about allowed charges, we're referencing the allowed charges listed in the Medicare fee schedule. This lets us compare similar charge figures across all providers and claim submissions, regardless of the submitted or paid amount. Let's talk about the metrics of the CBR. This is a list of the metrics analyzed within this CBR. Each metric was created to take a more detailed look at the submission of claims for wound debridement. The metrics are percentage of claims billed with add-on codes, percentage of allowed charge amount with add-on codes, and average number of units per claim with an add-on code. The list of the metrics helps us to understand the criteria for receiving a CBR 202107. Using the data and research, the CBR created criteria to select the providers who will receive a CBR 202107. That criteria is that the provider is significantly higher compared to either the state or national averages or percentages in any of the three metrics, which would be greater than or equal to the 90th percentile. And the provider has at least 5 beneficiaries with claims for CPT codes for wound debridement as defined within the report, and the provider has at least $1,500 or more in total allowed charges. Let's look now at the outcomes that could come from each comparison for the metrics. All 4 outcomes are listed here. These outcomes are the basis of the comparisons made regarding the provider's billing patterns and those of their peers. The 4 outcomes that can come of each metric analysis are significantly higher, which means the provider's value is greater than or equal to the 90th percentile from the state or national mean. Higher, which means the provider's value is greater than the state or national mean. Does not exceed, which means the provider's value is less than or equal to the state or national mean. And then not applicable means that the provider does not have sufficient data for comparison. The significantly higher outcome indicates that the provider's value is greater than or equal to the 90th percentile from the peer state or national mean and is part of the criteria for receiving a CBR. In order to talk exactly about how we calculate the 90th percentile, let's go to our next slide. I think that the visual on this slide can help us to understand the true meaning of the 90th percentile. It is important to fully understand these outcomes as they are the criteria for receipt of a CBR. In order to identify the providers who were above the 90th percentile, we calculated values for all providers for each of the metrics in each comparison group, which would be their peer state and nation. We then order all of the providers' values from highest to lowest. If you use the ladder of the visual as a reference, imagine that the highest values are listed at the top of the ladder, and then in descending order down the length of the ladder, so the smallest values are at that bottom rung. Next, we identify the value below which 90% of the provider's values fall. This is the 90th percentile mark represented above on the ladder visual by the black line. Any outcome for a metric in which the provider's value falls above that point would therefore have the outcome of significantly higher for the metric. Let's look at each metric individually and the outcomes for the sample provider on our sample CBR. Looking first at metric 1, the percentage of claims billed with add-on codes. To calculate the metric 1, the count of unique claims with add-on code is divided by the count of unique claims with a base code only, a base code and an add-on code, or an add-on code only. Let's look at the sample figures on the CBR for metric 1. This provider had a percent of 89%, and when compared to the state and national percent, the outcome for this provider for this metric was significantly higher for both of those comparisons. Next, we have metric 2, percentage of allowed charge amount from add-on codes. Metric 2 is calculated by dividing the total allowed charge amount for add-on codes by the total allowed charge amount for claims with a base only, a base and add-on code, or add-on code only. With that in mind, let's see where the sample provider fell with their results. This provider had an outcome of 87%. And again, when compared to the state and national outcomes for this metric, this provider had a result of significantly higher for both comparisons for this metric. Finally, we arrive at metric 3, the average number of units per claim line with an add-on code. This metric was calculated by dividing the count of units from claim lines with an add-on code by the number of total unique claim lines with an add-on code. Let's see the sample figures on the CBR for metric 3. This provider's average was 14.16. And again, with the comparison to the relatively low state and national averages, we can see that this provider had an outcome of significantly higher for both comparisons for this metric. This CBR includes graphs that represent the provider's billing trend over the 3 years 2018 to 2021 for analyses of the total number of beneficiaries for whom wound debridement services were provided. The graphs are split by types of wound debridement. Figure 1 shows the subcutaneous wound debridement. Figure 2 is muscle fascia, and Figure 3 is bone wound debridement. So let's see the sample of the data on the sample CBR. After the detail of the metrics and analysis, it is nice to have these graphs, but take a step back and review an overall analysis for that 3-year time period. CBRs can play a very important role for providers, and as we know from earlier in the webinar, they are meant to be educational and comparative tools for providers. A CBR can help providers to look at their internal claim submissions for areas of coding and billing that have a high possibility for incorrect payments. These reports can guide a self-audit program for compliance and shine a light on correct coding for the CBR topic. At this point, I want to review the resources we have available to you if you received a CBR, or even if you would just like further information about the process. We have a helpful resources page, cbr.cbrpepper.org/help-contact-us. On this page, you'll find a frequently asked questions link and a link to submit a new help desk request. I always encourage people to review the frequently asked questions before submitting a help desk ticket because those frequently asked questions may be able to answer your inquiry. Here is a closer look at the frequently asked questions page, which is found at cbr.cbrpepper.org/FAQ. This page contains the list of frequently asked questions and has links to answers to various questions that you can see here. Simply click on the question, the answer will populate. This list has proven helpful to many people who have questions about the CBR process. These helpful resources are the documentation and reporting that the CBR team used in the creation and the analysis of the CBR. You'll see the CPT manual, the Medicare Fee-for-Service Supplemental Improper Payment Data Report, and the article that we talked about earlier. This is a screenshot of our homepage, cbr.cbrpepper.org/home. There are sections for each of the CBRs that we have released in 2019 and 2020. For each CBR topic and release, we provide links to a sample CBR, the training materials, the data set, and a link to access your CBR. This page also contains a link to join our mailing list and stay up to date on any announcements, a link to provide feedback on the CBRs, and a link to submit a CBR success story. We would love to hear how the CBR process worked for you and your organization. Once again, I would like to thank you for joining us today for this review of the CBR 202107 Wound Debridement. If you have any questions about this CBR, please do not hesitate to reach out to our help desk.